Welcome to Health Diary. My name is Gladys Gachanja and we're coming to you from the 4 Points by Sheraton here in Hurlingham. Now, fibroids is a topic a lot of the ladies have wrote in and asked that we discuss it because a lot of you are concerned that younger and younger women are dealing with this problem, and also the fact that it is highly associated to infertility. So today we shed light on uterine fibroids, but before we get to it, here now is a fact of the matter. Fibroids are abnormal growths that develop in or on a woman's uterus. Uterine fibroids are non-cancerous and often appear during childbearing years. Sometimes these tumors become quite large and cause severe abdominal pain and heavy periods. In other cases, they cause no signs or symptoms at all. It's unclear why fibroids develop, but several factors may influence their formation.
I didn't know I had fibroids until late March this year. I was feeling unwell, just the normal unwell like bacterial infection-ish. So I went to the doctor to do some tests. While he was examining me, he noticed there was below my abdomen, it was very hard. And he was like, "Are you pregnant?" I'm like, "No, I'm not pregnant." And then he's like, "Okay, for us to overrule anything, let us do an ultrasound to see what is wrong." So when I went for the ultrasound is when the sonographer, so I had like 3 big fibroids and multiple small ones. I started crying immediately, and the thoughts were running through my mind. I was like, am I going to be a mother? Will the man of my life maybe leave me because I have fibroids, so I'll not be able to conceive? Even if I conceive, will I be able to carry a baby to full term? I had very heavy periods, like I could change like after every 2 hours. Another symptom was low blood levels. When I used to have my periods, my levels will really go down. My body become weak, headache and heavy cramp, as in painful cramps that I had to be on painkillers every now and then and to rest because I used to feel very weak. My stomach had swollen to a point like I looked pregnant. People used to say, "Congratulations, how far are you?" And I was just there laughing. I was like, "No, I'm not pregnant." There are different options for fibroids to be treated, but for my case, since mine were big, the only treatment was to do surgery, open myomectomy. It's just like a cesarean section. They open you up, remove the fibroids. Since now I don't have a baby, I told the gyna to preserve my uterus. The doctor removed 9 fibroids. There's one which was so big, it looked like I was carrying a 3-month baby. There were fibroids inside my uterus and outside the uterus. So after the surgery, my periods have reduced. Cramps are there, but not as painful as they were before. And I'm not weak during my periods, and my levels are okay. I'm still on the healing journey because the healing takes almost 6 months. So for now, I can't do any strenuous activities. Every year, you can go for a checkup, do a pap smear or do an ultrasound for them to check if you carry these things, because other people don't have symptoms. It's not the end of the road. It's treatable. Once they're removed, they can get better and they can start a family if they want to.
So let's discuss about fibroids, and to help us understand this better, we have Dr. Alfred Mukomba, who is an obstetrician and gynecologist, and we are also joined by Fatma Mohammed, who is a fibroids warrior and also the founder of WellnessKE. Thank you all for this conversation, and I'll start off with you, Dr. They say it's unclear why fibroids develop, but from your experience, what factors do you think kind of influence the growth of these abnormal growths?
Fibroids are mainly genetic, more common in those of the African race, and they are more common in the reproductive age group between ages 20 to around 45 is when they cause more problems.
Okay, they say pregnancy is also a risk factor. Explain.
It's not a risk factor as such. Actually, those who get pregnant early, the fibroids tend not to grow as much, but during the pregnancy, because of the high hormone levels, there's something we call estrogen. The fibroids can grow to a very large size from a very small size within that short time. So the pregnancy itself, the hormones stimulate growth of the fibroids. But ladies who say have not had a pregnancy by say age 30, 35 are more prone to develop uterine fibroids than those who have had pregnancies and childbirth.
Okay, and is it true or a fact that 80% of women are bound to develop fibroids at some point of their lives?
It's actually true. If you picked, say, 100 women and did random ultrasounds, almost 80% will have a fibroid or the other. The thing is, most of the times the fibroids do not cause any trouble. So we only should interfere when they cause trouble.
Fatma, when were you diagnosed with fibroids?
I was diagnosed with fibroids when I was 21 years old. So I just turned 35.
We talked about the familial connection. Yeah. Do you have this in your family?
My mom and my aunties. Mine was actually like a really tiny fibroid. And then it was asymptomatic. I did not have any symptoms. It's just that I felt some kind of mass inside my abdomen. When I went to the hospital is when the doctor told me, you have fibroid. And I didn't know what that was about. And he told me we do what is called the waiting period, whereby let's just see whether something bad will happen, or if not, it might disappear. But then, of course, unfortunately, it did not disappear. That's when they grew in size and in number, and then I had to have my surgery.
Apart from the risk factor of genetics, definitely, obesity, being overweight, lifestyle, the smoking, the alcohol intake, would that influence?
Yeah, to some extent, some element of obesity, because with obesity, people tend to have high hormone levels. And this can stimulate the fibroids to grow when somebody who already has them. But smoking, not quite, yeah.
Okay, and to something that she has actually alluded to, that she started off when she was very young, and then she was told, wait until we see if it's going to create any problems. Yeah. Is this common?
If they are not causing trouble, we prefer to just observe instead of going into those invasive procedures.
All right, and some of the symptoms, as she says, are those ones associated with the usual menstrual cycle every month. So what are these symptoms that are so definitive about fibroids?
Yeah, the most common is heavy menstrual bleeding. Most women will bleed until they become anemic, their blood levels are low. That is the most common symptom of fibroids by far. There are some now when the fibroids are very big, then it will cause what we call pressure symptoms. It will press on the surrounding organs like the urinary bladder, so they might have problems passing urine, and it might also put pressure on the other organs in the abdomen to cause pain.
Fatma, you mentioned that it was small, tiny, but later on grew to, did it multiply to other fibroids, or it was the same one that grew?
It multiplied to many fibroids. So I had over 20 fibroids removed actually. And I was really frustrated because when I was diagnosed, I was told it's a pea-sized fibroid. I experienced a lot of pressure on my abdomen and also in my pelvis, So frequent urination and also a lot of constipation. You get to have a lot of constipation issues. I used to have to go into hospital to get enemas just because of that. And other than that, I also ended up being diagnosed with deep vein thrombosis, which is actually really scary. And I always want for women to know that when you have fibroids, it could lead to another diagnosis, which in my case ended up being the blood clot in my leg.
Just a little on the deep vein thrombosis, because the fibroid is pressing on the blood vessels that drain especially the legs. So because of stagnation of blood, it clots, and it creates the deep vein thrombosis, which can be risky because if it dislodges to the chest, then it can be life-threatening. Like I said, bleeding with anemia, so the woman will feel fatigued, she gets tired easily on even doing small duties which she would do effortlessly before that. They can lead to breathing problems and difficulty, problems in their diet. They are not able to eat properly because of the issues with their constipation, a lot of gas in the abdomen, and eventually acidity.
Now back to the pregnancy. There are some that have said the fibroids actually put them at risk. Explain.
The fibroids can grow so fast they outgrow the blood supply, so they start undergoing some changes. It's like the tissues of the fibroids die off and it causes a lot of pain. The worst one is during delivery, because the uterus is not able to contract properly because of the presence of fibroids. They end up with what we call postpartum hemorrhage. The lady can bleed profusely.
Can it lead to miscarriages?
Early on, yeah, if the fibroids are many and they are causing limitation in space, yes, they can.
All right, so did they ever tell you which type you had or where were the placements for the fibroids?
They did. So I had the fibroids were actually on the outer part of the uterus. And then as they kept on growing in number, increasing in number rather, I ended up having some that were inside the uterus. There's some women who are not aware of the fact that just simple things like even aerosols and some of these things that we use, even products on our body, they do end up in our system that mimics estrogen, and then you end up having high estrogen levels, and then you end up having these kind of conditions.
Is that a fact in as far as that being a risk factor, the things that we use on our bodies?
Yeah, because you know all these beauty products, sometimes we don't know what they have. They have a wide array of chemicals combined with it, and they can contribute.
Okay.
So one has to be conscious of the contents of what one uses, so they don't cause harm, not just to cause fibroids, but especially the kidneys, the liver, and the like.
So what is this elements in these things that we should look out for?
The worst in the past was mercury, because it was causing kidney problems. There are some that will have some of the hormonal components, especially the skin lighteners. They have steroids, and estrogen is actually a steroid. Those ones will stimulate things like fibroids to go even more, apart from causing other problems in the body.
Now, before we take our break, Daktari, types of fibroids, which are they and how do they manifest?
You can have those that grow within the uterine cavity, what we call the endometrial cavity. Those are the ones that cause most trouble in terms of heavy bleeding, and we are able to pick them early because the bleeding will show itself very early when the fibroid is small. Then we have those that are within the muscle, within the uterine muscle. They are called intramural. Those ones, initially they will not cause problems, but once they are big, then they'll still contribute to these problems we have alluded to. And then you have the ones that grow on the surface of the uterus. These ones normally don't cause trouble. These are the ones we pick when they are so big, because they don't cause pain, they don't cause bleeding. Is when they have become big now to cause pressure symptoms is when we pick them up. Yeah, those are the types we have.
Okay, we take a short break. When we come back, it has been said fibroids is the biggest or are the biggest causes of infertility. So what's the science behind it? Daktari will tell us right after this break. Stay with us. Welcome back to Health Diary. My name is Gladys Gachanja. Today, the conversation, uterine fibroids, as we understand this much better. And still with us, Dr. Alfred Mukomba, obstetrician, gynecologist, and Fatma Mohammed, who is a fibroids warrior. And before we went to break, I actually made mention that fibroids are the biggest causes of infertility. What's the biggest, or what's the science behind it?
Yeah, actually, uterine fibroids on their own do not lead to infertility as such. When the kind of fibroids that will cause infertility are the ones that will be growing in that part of the uterus where they'll put pressure on the fallopian tubes and cause a blockage. Those are the ones that cause miscarriage. There are the others, when they are very big, of course, the uterine cavity is obliterated. It is full of the fibroids, reduce that space, and then that will prevent implantation and therefore contribute to some element of infertility.
Fatma had fibroids at a young age. They already were wondering what it is that not having kids could be the reason. Do you have kids now?
I don't have, and because I had my surgery, that's 2 years ago. Every time I would go into hospital to get the operation done, they wanted for me to have a hysterectomy, and I never wanted to remove my uterus. I think that it's also really important for us to mention that there's some younger women who are having hysterectomies done because doctors are recommending, but the truth is they still don't know why they have the fibroids. Maybe they're going to end up having PCOS because they still have issues with hormones. So fixing the issue first before fixing the fibroids, for me, that was the goal. So that's why I ended up having them removed at such a later stage.
Were you ever worried that this could put you at risk of not conceiving?
I never was, and I don't feel like that, because the truth is I ended up eventually finding out why I had the fibroids. I discovered that I had high estrogen levels, meaning I had to do the tests, get my estrogen levels checked. I found out that. Now I switched my lifestyle. I became vegan. I switched my diet. And the moment I did that, I fixed the issue. So now, after fixing the issue, I was like, now I'm confident enough to have the surgery done.
Daktari, I see you shaking your head because you're agreeing with what she's saying. So you have had a lot of doctors rush to the hysterectomy solution.
Because the definitive treatment for fibroids actually is surgery, but hysterectomy should be the last option. Most times, one should do conservative surgeries, what we call myomectomy, to remove the fibroids, and it's doable irrespective of the number of fibroids that one has. So it is not an option that should be offered to younger women. For the older women who have had their desired number of children and they have no issues with their uterus being removed, then that can be done. But now we have something called uterine artery embolization, where we inject some chemicals into the blood vessels that supply the uterus, and it blocks. So you starve the fibroids and they shrink, and one is able to avoid surgery. And that is now available in our country. Apart from that, there are some medications which we are able to give, and that drops the levels of estrogen and the fibroids shrink. And this applies especially in younger women who you don't want to do hysterectomy if the fibroids are very large. So it shrinks later. You can just be able to remove the fibroids alone and leave the uterus intact, and she'll be able to get pregnancies and get children whenever she's ready.
Okay, so what informs the treatment plan you'll apply on a patient?
Yeah, many factors is the size and number of fibroids, the age of the patient, and whether they have had the desired number of children, so that one can be able to decide, is it the fibroids alone, or you're going to do a hysterectomy. Because ultimately, it is the lady who should make the final decision after she's given all the information on what she has, what problems it's causing, and what treatment options are available.
Now, Fatma, you have elaborated that you have had to change up your wellness, and be keen about some of the things you eat and stuff like that. So what are these foods from your experience that increase the risk of dealing with fibroids?
So whenever I would take dairy products and also red meat, that's when I would get lots of inflammation in my body, and I would get a lot of pain. I would be admitted, they would inject, and sometimes that wouldn't work. I would pass out from the pain. And when I cut them out, I replaced them, like in the morning, because we always have to have tea and all that, I would replace them with a fresh juice or a vegetable juice, a healthy juice, I saw a lot of change. Because at that time, you see, my abdomen had really protruded. It looked like a pregnancy. I never used to make queues at the bank. People thought I was pregnant, but I was not. The foods that I started eating more of are vegetables, nuts and seeds. Like I would put lots of sesame seeds in my food. I ate more avocados. I started substituting dairy for, plant-based milk.
Daktari, there are a lot of people who opt to take on home remedies, as she is mentioning. Is this advisable, or do you do it under the supervision of a doctor?
Yeah, sometimes there are those, actually most of the treatment are personal initiative, what one can do for themselves. Exercise, you reduce the proportion of meat products, a lot of wheat products, take more of the vegetables, more fruits, reduce anything that will increase cholesterol in the body. And those are the things that will contribute to the general well-being of anybody who takes that, and ultimately that contributes to the management.
You said you underwent surgery and all that. I'm just wondering, is any of this covered on NHIF, insurance companies? How does this work?
I don't want to be the devil's advocate, but I have to say majority of these specialists are really expensive. I know other people who have also had the same thing happen to them, but none of it is covered. If I can be completely honest, I would say most of my money that I worked for went to doctors, and that still pains me. It would be really a good thing if women are able to access all this information and also the treatment. If it can be covered.
The cost of treatment clearly can be a huge impediment to accessing timely diagnosis. Daktari, what needs to be done to actually turn this around?
The best way is if we had, people have access to gynecological care, so that one doesn't take a long time before the problem is picked. And secondly, to limit the number of tests one can do. The best is what we call an ultrasound scan, which is fairly affordable, and it will pick most of what we need. If you can have it in a slightly cheaper hospital, there are good ones that are safe, is to avoid the bigger hospitals because they are pretty expensive. In public hospitals, the NHIF will pay everything for the patient. In the private hospitals, they might pay something like maybe 100,000, and then one has to top up depending on the hospital where they are admitted. A choice of treatment plan very early will reduce the cost significantly.
Okay. What I'm hearing is that information is power, especially when it comes to the management and diagnosis of fibroids. And I know, Fatma, you're very passionate about creating awareness on the same. Your parting shot?
I would really love for women and also men, let me say, because health is really important, for all of us to really just take care of ourselves. Before you get to the place where you need the doctor to give you treatment, please take care of your health and your well-being. And diet plays actually an 80% role in how your body looks, how it's going to feel, and whether you have disease or disease. And that's why I founded my platform, WellnessKE. So I really want for anyone out there who has questions, they can be able to send them through the social media platforms. I really like to link people with the best doctors, the best, treatment, the best information, so that they can just take care of themselves.
I think I need you to speak to the fact that there's a lot of ignorance that is fueled by tradition and religion, because there are people who think of going to a gynecologist and it stops there.
And that's what most women will experience. It's like it's a taboo. Most women will not find it easy to go and say, I'm bleeding heavily. They'll not tell their parents. Even our parents will not tell us easily. They'll suffer in silence, not only for uterine fibroids, but for everything. But what we advise is if there is anything abnormal, there is bleeding, there's a lot of pain, there's a lot of discomfort, the abdomen is getting swollen, do not keep quiet. It is okay to bring it out and you're examined. If it's found there's nothing, that's all right. Yeah, so there's nothing wrong with people coming out to express their problems. irrespective of their religions, because I know there is no religion that prohibits any form of treatment. It is just the culture, and sometimes stigma should not bar you because you are the one with a problem. Yeah. So you should come out, and most times it ends up very well.
Okay.
Yes.
All right. Asante sana, Dr. Alfred Mukomba, obstetrician and gynecologist, and Fatima Mohammed, fibroids warrior, and also the founder of WellnessKE. This was very informative, and I think this will empower many other women to take charge of their reproductive health. Time now for the health tip.
If you have HIV, you need a lot more vitamin C. Now, yes, it's true. Vitamin C is in fruits, it's in oranges, and so on. It's good. Moringa also is a good plant for vitamin C. Strawberries are fantastically high. Greens like broccoli is very high. All these foods are good. Vitamin C is important. Zinc is important. Zinc is a mineral that boosts the immune system. It's in seeds. So eating seeds is a very important way to boost the immune system. Selenium is a mineral that also boosts the immune system. And selenium is in anything that begins with SE. It's in seafood, it's in seaweed, it's in simsim seeds, sesame seeds. So again, seeds, nuts, seafood, all of these help to boost the immune system.
It has been Health Diary. Thank you for your support and engagement on social media. Well, we have been coming to you from the 4 Points by Sheraton here at Hallingham. My name is Gladys Gachanja. Until next time, see you.